Thanks for staying with us here on MorningLine, where we're having a great discussion with Dr. Seth Banks about depression and suicide prevention. We thank everybody who's called so far. We would like you to continue to call in. That number 615-737-7587. So we're going to go ahead and talk to Mary. Oh, we're going to wait for that. So let's continue with our conversation. When somebody commits suicide, there is so much guilt, possibly shame that families and friends go through, saying, I wish I knew. I didn't think it was so bad. How do you even begin to have those conversations to cope with that?
Yeah, that's a very, very difficult process to go through. And I think it's difficult, especially in light of what we're seeing right now. Obviously, this is spurred on by the Robin Williams tragedy. And it's difficult to deal with this on a personal level. If someone you know has committed suicide, I can't imagine what his family is going through watching him play out publicly in the media and having to not only deal with it internally, but be reminded of it externally constantly when you turn on the news or get on your favorite news website or look at a newspaper or whatever. That makes it even more difficult. But I think one of the things that we just need to do is kind of, start by opening up that conversation. Letting people know that you're there for them, letting your friends and family know that you care for them and that you're there to talk about the issues, whatever they may be going through. Because you're right, there is shame, there is guilt involved. We all think, gosh, I wish I could have done something, or I wish I could have, what could I have done to change things? And it's important to be that support for those people. Okay, now we can go to Mary on line one. Mary, thank you so much for calling.
Sure. I would like to share my experience, if I may.
Yes.
Clinical depression hit me when I was 23. I am now 58. I've dealt with it all my life. I've been through all the meds, through psychotherapy 3 times, 2 years apiece. My doctor finally decided the only option left for me were ECT treatments, shock treatments, scary stuff. It worked miracles for me. I don't want to put anybody off or scare anybody. It is an option for major clinical depression. It is an option. I guess that's about it.
Mary, how are you feeling now?
I feel fine, and this has been several years ago. I am on a maintenance medication that's actually an anti-epileptic medication, using it as a mood stabilizer. All I'm saying is there's something else left to try. You just have to get the guts and go with your doctor's recommendation when everything else has failed.
Mary, thank you so much for calling. I'm so glad that things are going so well for you.
And that is a good point. Certainly, we talk about, because they're the first line therapies, because they're the first things we think about, especially myself as primary care physician. We think about medications, we think about some of the common medications, we think about psychotherapy. And there are certain people who those just don't work for whatever reasons. They have this severe refractory depression that just won't go away despite the usual treatments. And certain ECT is an option. It's far from the first line option. And, we all have a lot of negative connotations with it. Most of us have seen One Flew Over the Cuckoo's Nest and, what Jack Nicholson went through in that movie and get a negative connotation with it. But it is it does work, as she's alluded to. So, if you're a patient who has had some severe clinical depression and you've tried multiple modes of treatment, certainly that is an option.
And we don't want to make it seem like dealing with depression is easy stuff. Like you can just take this medicine or go to therapy and it'll be done. Sometimes it's very difficult to find what's working for you. The medicine, you said it might take a little bit for the medicine to kick in. Talk about that.
Yeah, absolutely. It does take a while for medication to kick in. It's important that people are aware that there's no quick and easy fix for this. There's no, whether it's therapy, whether it's medication, it's not like there's one single happy pill that you give somebody and immediately their mood lifts. To truly treat clinical depression, it takes weeks, months, even years sometimes. And everybody's episode with depression is different. So different people respond differently to different medications, to different treatment modalities. So whereas your friend, your family member may have went on a certain medication, felt better in a month, you may go on that medication and it may take 2 months, it may take 3 months, or it may take a different medication. Sometimes, unfortunately, there's no recipe to this. Sometimes it's a little bit of trial and error, and I think that's frustrating both for patients and for clinicians as well, because we want to be able to say, oh, here's the road to success, road to recovery. And sometimes it takes a while, and that can be frustrating.
You just have to commit to the process.
Absolutely.
And it's definitely a process.
Yes.
And as you heard with our last caller, she had been dealing with it for years and tried one thing after another and after another. It's not easy stuff, but as you hear, she has found what works for her, and she can live a good and healthy life. All right, let's talk to Tony. Tony, thank you for calling.
Yes, good morning. Thank you for taking my call. I'm always trying to look at the bright side, but I'm suffering through depression real bad.
Okay.
It wasn't in my early years, till later years. Then when I found out that my uncle, my mom's side, committed suicide, that was a family secret. It made it worse, and I'm hoping that it's a positive side coming in, but you need family support, and I don't see much family support. Nobody talking about that much.
Okay, Tony, let's see if we can help you here.
Absolutely. I think it's important to find the positive people in your life and surround yourself with them, whether it's family, whether it's friends, whether it's coworkers, whatever the case may be. I think it's important to find that positive network and surround yourself with them. And as one of our callers alluded to earlier, kind of eliminate the negative influences, the people who drag you down, the people who frustrate you, the people who may be leading you into a spiral, into depression. I think it's important to kind of eliminate the negative and truly accentuate the positive in your life, especially if you're going through some sort of clinical depression.
And it's important to underscore that some of the people that are the most supportive might not be your family,
Absolutely.
although that might be difficult.
Absolutely, and it is important to note that certainly a lot of people do lean on family in hard times, but you're exactly right. For everyone, family isn't necessarily the number one or main support system. Sometimes it's friends or coworkers or a club or a team or whatever kind of other activities you happen to be involved in, church, whatever seems to be the positive influence in your life. It's important to reach out to that.
And Tony, it's so great that you identify that something is wrong and that something needs to happen to change that. So I think that is really courageous of you to do that. So what should he do? He says something is wrong, I need help.
Sure. I think one of the first things is to discuss it with your physician. Usually, obviously as a primary care physician, I would say start with your primary care physician and let them talk with you and determine exactly what the issue is, what the severity of it is, and then you can kind of decide for a treatment plan. Do you need medications? Do you need psychotherapy? Is this something that's more severe or more prolonged that maybe needs care of a dedicated psychiatrist or psychologist? Those are decisions best left in the hands of an expert, and I think that's kind of the first place to start.
And so there's another number that I really want to make sure that we highlight. That's a suicide prevention hotline. If you are having suicidal thoughts or feelings, it's so important to reach out and call somebody, to tell somebody. That number is 1-800-SUICIDE, 1-800-784-2433. Again, 1-800-784-2433. If you're having any type of feelings, it's important to just reach out and let somebody help you. Kind of talk about that. If somebody doesn't call a hotline but tells a friend, what are you supposed to do?
Sure. As a friend, well, there are a few things. Obviously, providing the support, like I said, letting them know that you're going to be there for them, and letting them know that you're there to help them seek help. Offer to go with them to the doctor, help let them know, hey, I'll be there for you. Let them know that there is a support. Offer to take them to the doctor if need be. If it's somebody who's acutely suicidal who has a plan, offer to take them to the emergency room, or if necessary, call 911 to get necessary, professionals there involved. I mean, certainly in an acute situation, those are things you can do. And if it's somebody who, says, hey, it's something I've been thinking about, I've been having these overbearing thoughts, then it's important to, accompany them along with their journey and kind of help, funnel them into the healthcare system and try to get them the help that they need.
Mm-hmm. Fantastic. And we still like you to call in 737-7587. We are going to talk to Brian now. Brian, thank you for calling.
Thank you. I was wondering if some jobs have a higher rate of depression. Just watching the news about what's going on in Ferguson, Missouri, and all the bad stuff that's happened this week, it seems like the news can be depressing at times, and even as a news reporter, I'm sure it's probably hard.
That's right, it is hard sometimes.
Just wondering if there are some jobs that he sees that are more higher rate of depression, and how should people cope with that?
Great question.
That's an excellent question. I think certainly high stressful jobs can lead to higher rates of depression. And while I don't have the numbers off the top of my head, obviously, people in law enforcement, people in medical care who, see people who are sick or dying all the time, things of that nature, certainly that can be a risk factor for depression if your job is consistently stressful and you're consistently presented with difficult situations and bad images and things of that nature. And I think it's just important to be mindful of those things, to be mindful that your job has this high level of stress, so that, once again, as I mentioned earlier, as the caller mentioned earlier, recognizing those self-warning signs, recognizing those things that, hey, maybe this isn't normal, maybe this isn't just, I'm blue or upset because this happened. Maybe this is something a little more serious and I need to seek some help.
And I think that when you have a job where you're seeing all of that, you've got to practice self-care and really, know what you need to kind of balance things out. What types of things are good for people to do to kind of practice self-care if they've got a stressful job or in a stressful environment?
Well, a couple things that I like to recommend, aside from, the general things that I've mentioned before, are keeping active. I kind of try to promote health as a whole, healthy body, healthy mind. And I think those two things kind of go hand in hand. So making sure that you're exercising, making sure that, you're going out and engaging in activities that are pleasurable, making sure that you're eating right and eating healthy and maintaining a healthy lifestyle in that regard. While I don't think any of that is necessarily a true cure for clinical depression or anything of that nature, they are certainly things that can help promote positivity in your life and help promote your own self-awareness and help push you in a positive direction.
If there's anything that folks take away from our discussion today, what do you want it to be?
What I want it to be is just that there shouldn't be a stigma, there shouldn't be a shame with depression or with feelings of hopelessness and helplessness. If you're having these thoughts, if you're having these ideas, if you really if you really need help, then please seek it. There are plenty, and there are just numerous areas of opportunity out there. And ultimately the goal is to get you healthy and get you happy again. One of the things that I was reminded of as I was looking through this over the past week or so was the Robin Williams quote from the movie Patch Adams, where he said, "The most radical act that a person can commit is to be happy." And I think that really rings true.
Yeah, thank you so much. I think that's a great place to end. This Dr. Seth Banks from TriStar Summit Medical Center. I think that, hopefully we helped a lot of people today in just normalizing their feelings and knowing that, if anything, they are certainly not alone. There are a lot of people out here that can help you, that care about you and want you to be well. So thank you so much for joining us.
Thank you very much. Thank you for having me.
All right, and we'll be back.